In the 2 days since Thanksgiving, there have been 346,000 new confirmed COVID cases in the United States and 2,700 deaths. Of course, we won't know for a while how bad the surge of cases and deaths due to Thanksgiving weekend travel will be. Joining me now is Dr. Anthony Fauci, who, of course, is the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome back to Meet the Press. I think this other statistic tells the story of November pretty well. The total number of coronavirus cases in the United States for November surpassed 4 million on Saturday. That's more than double what we saw in October. What are we staring at in December, considering, I guess, Halloween was part of this early surge in November? What should we expect in December, sir?
Well, if you look at the slope of that curve that led to the numbers that you just mentioned, Chuck, we're going to be seeing, as we go towards the end now and getting into December, we're seeing the surge with an inflection curve like this. The concern we had as we entered into the Thanksgiving holiday and as we're now coming out of the Thanksgiving holiday is that the travel and the people congregating at dinners that you'd expect, we try to get the word out for people, as difficult as it is to really not have large gatherings of people, family and friends, but try to keep it confined to the immediate household. But you know, people are not always going to do that. So what we expect, unfortunately, as we go for the next couple of weeks into December, that we might see a surge superimposed upon that surge that we're already in. And, you know, and when I give that message, I don't want to frighten people, except to say it is not too late at all for us to do something about this, because as we travel back, to be careful when we go back to where we are, to just continue to do the things that we've been talking about. An important issue, Chuck, is that we know when you mitigate with masks, with distance, with not having crowds or congregate settings, that those states that have done that, you could actually see that the inflection of their curve starts to do this. So we know we can do something about it, particularly now as we get into the colder season and as we approach the Christmas holidays.
Look, it took what was it? I think it was only about a week before Thanksgiving that the CDC came out and advised against travel. Are we going to see more dire warnings given about travel now, essentially now, in the next week or two, as we prepare for the end of the year holidays and New Year's?
You know, Chuck, I'd have to say honestly, unless something changes dramatically, which I don't see that happening, because the curves, when you look at the dynamics of an outbreak, that you see usually a 3, 4, 5 week period of time before curves start really coming down. So I think we're going to be faced with another situation. We're going to have to make decisions as a nation, state, city, and family, that we're in a very difficult time, and we're going to have to do the kinds of restrictions of things we would like to have done, particularly in this holiday season, because we're entering into what's really a precarious situation, because we're in the middle of a steep slope. You know, when I tell what people need to do, we say it over and over again. We know it works, but also that there is, as I mentioned to you before, Chuck, there is light at the end of the tunnel, because we will really be seeing vaccines soon. We likely, almost certainly, are going to be vaccinating a portion of the individuals in the first priority before the end of December. And then as we get into January and February and March, more and more. So if we can hang together as a country and do these kinds of things to blunt these surges until we get a substantial proportion of the population vaccinated, we can get through this. There really is light at the end of the tunnel.
What is your confidence level that various hospital systems are going to hold up right now? I mean, look, the warnings are coming from all over the country. I know you guys see these reports on the task force. I saw one earlier this week. It was something like 1 in 5 healthcare systems around the country were on the brink of basically being overcapacity. They were already over capacity. The next 2 weeks could make it worse. Healthcare workers themselves, there are not enough of them. Are you concerned about failing systems around the country?
You know, Chuck, I have to say that I am, and I am because reality stares you right in the face. Just last night, I got a couple of calls from colleagues and associates who are very much involved in different states throughout the country saying, we're at that point where we soon, if things don't turn around quickly, we're going to have a situation with capacity, not only of hospital capacity, but staff. You know, what do you think we should do? I mean, almost pleading for advice about, you know, what can we do? We don't want to lock down completely, but we might have to. If this, and I'm talking locally, I'm not talking about nationally. I'm talking about individual locations of people starting to see significant stresses on the hospital and healthcare delivery system. So again, that's such an even more important reason why we've got to realize that we do have within our capability to be able to blunt that by doing the simple things that we talk about short of locking down, so we don't precipitate the necessity of locking down.
Is this, look, I don't want to belabor a point about the federal response here that you and I have talked about in the past, but how about getting the president to talk about not traveling over the holidays, or getting the president to talk about wearing a mask again? Is that possible?
You know, I don't know. I mean, it certainly is possible, Chuck. I mean, but I don't think I have any power in that regard. I mean, so what I'm doing is the best that I can do, you know, and thank you for giving me the opportunity to speak to the nation on a national program to talk about the importance of those kinds of things that can have an impact.
Let's talk about the vaccine. The CDC is going to put out some protocols on who should get it first. It's pretty clear in the conversation you and I are having, it's healthcare workers. Probably should be priority 1 and priority 2 here. What does that look like? How realistic is it to get the nation's leading frontline healthcare workers vaccinated by the end of January, say?
Well, Chuck, I think certainly the healthcare workers are going to be among those. I don't know exactly what the precise final decision is going to be. Certainly healthcare workers will be up there. There may be others. I don't know. As you know, on Tuesday, the Advisory Committee on Immunization Practices, either Tuesday or Wednesday, sometime early next week, are going to be coming in, meeting with the CDC and making those kinds of decisions. But if you look at the number of healthcare workers, obviously you're going to have to do it in a graded way. I mean, we don't have enough vaccine right now in the first, in the last week or 2 or 3 of December to be able to get everybody who needs to. And that's the reason why what happens is that a certain amount of vaccine gets shipped locally to the states. And then the final decision of how to do that properly will be left up to the states with strong recommendations from the CDC.
So let me get into some specifics asks, because there's people watching here. Hey, I've got a parent or a grandparent in a senior facility. Maybe it's a nursing home, maybe it's a senior living, care. When will they get it? How early in this process do you expect them to get a vaccine?
Yeah. Again, I don't want to get ahead of the advisory committee, but I can tell you what likely will happen, certainly not definitive, that people in nursing homes will likely be very high up there in that facility. If you look at the number of people who are in what's called official nursing homes, there's about 1.5 million people. If you look at the people who are the staff that staff those official nursing homes, that's about another 1.5 million. So you probably have around 3 million people. I think you can get them protected reasonably soon because obviously they're very vulnerable. And then you go down the list of people who are elderly with or without underlying conditions, and you get the different priorities after that.
Let's talk about kids here. Moderna did not do any clinical trials with anybody under the age of 18, and I think Pfizer did some of its clinical trials down to age 12, but there hasn't been a lot. What is your sense of when should we expect school-age kids to be able to get vaccinated? Are we looking at the summer? Is that going to be a longer period of time here?
Yeah. Well, traditionally, Chuck, the direct answer to your question, it's going to be months. And the reason is traditionally when you have a situation like a new vaccine, you want to make sure, because children as well as pregnant women are vulnerable. So before you put it into the children, you're going to want to make sure you have a degree of efficacy and safety that is established in an adult population, particularly an adult normal population. Then there are ways to get children vaccine by, let's say, maybe in January. And again, this is my estimate, may not be exactly that that you go ahead and you do what's called a phase 1 and a phase 2A trial in children. In other words, you find out, is it safe in children, and does it induce the kind of immune response that's comparable to that in adults, an immune response that you know protects adults. And then what you could do is you can do a study, what's called a bridging study. You can say, okay, now we have safety in the children.
Right.
We have comparable immunogenicity, namely the same type of immune response. We can get this expeditiously approved for the children before going through a 30,000 person trial that may take a longer period of time. So we're going to
Gotcha.
start the process very likely in January to get it to the children sooner rather than later.
If someone has had COVID-19, do they get vaccinated?
The answer is very likely yes. When the trials were done, the Moderna trials and other trials, and we looked at the data, there were people who, when you looked at their antibody response, they actually gave indication that they had already been infected and actually recovered quite well. And at the time of the vaccine study, they were actually well and normal, as it were, and yet they still got vaccinated. Since we don't know the durability of protection from someone who has already been infected, how long that protection lasts, it would not be surprising that we would be vaccinating people who have recovered from COVID-19.
Given the, and you've admittedly said this, our sort of rough rollout of a testing strategy in this country, arguably we still don't have, we're still dealing with a testing strategy that arguably prioritizes sports leagues over healthcare workers at times. But let me ask you this, why should we feel confident that vaccine distribution will go smoothly, considering, frankly, how unsmoothly testing went?
Well, the reason that we should feel more confident about that, Chuck, is that we have a long, long history of the distribution of vaccines. I mean, it's not to the extent that you're giving it to 300 million people, but every year the system is set up in a relationship between the CDC and the state and local health authorities that they distribute 80 million or more vaccines every year. So this isn't something that they've done just for the first time. Obviously, you're going to want to scale it up because the numbers are going to be greater, but there are a couple of aspects to getting vaccine into the arm of someone who needs it. One is to get it transported from the place where it's made and stored to the local state and city areas. That's being handled by General Gus Perna and the military and the transport of that. Once it gets there, it's the state and local authorities who are responsible for the distribution. So there are a couple of phases. The part about 300 million doses getting shipped is going to be taken care of by people who know how to do that. The part at the distal end, namely getting into people's arms, is going to be more challenging than just a regular flu season. I think it'd be foolish to deny that. But I think it's going to be able to be done because the local people have done that in the past. Hopefully, they'll get the resources to help them to do that.
On January 20th, President Biden calls you up, Dr. Fauci. What's the first thing you say to him? He says, what's the first thing you want me to do, Dr. Fauci? What do you say to him?
I think there are going to be a couple of things. I think it's going to be continuing to make sure that the vaccines get distributed in an efficient and equitable way. I think that's really very important. I also have been, together with Dr. Birx, have been saying that, there are two types of testings, or a couple of types of testings, more than two. But one is the testing for a situation where you want to find out, is this person infected, and can we be able to do good identification, isolation, and contact tracing? And then there's the broader testing, namely one that's less sensitive, but that's testing people who are not symptomatic, namely a much broader blanket over the country in a way that's easy, that's cheap, that is even a home test. I'm going to be pushing for that because I think when you really allow us to know in a very quick way what the penetrance of infection is in any given way, I think that's going to be very important because the virus is being spread throughout the country by people without symptoms. So we've got to go beyond the symptomatic people and get a better understanding of the asymptomatic transmission.
Every day when I make a right turn to come into the office, when I do come into the office, there's a big sign that says, "Thank you, Dr. Fauci." Let me just say the same thing right now. Thank you, Dr. Fauci. Appreciate you coming on and sharing your perspective with us.
Thank you very much, Chuck. Thank
You
you
got
for
it.
having me.
You got it.